Hello everyone, I am Dr. Tanvi Mahant and welcome to my channel HomeoHeals. So from this month, I am going to start a new series specifically for homeopathic students and practitioners, where every month I am going to share my small case and which is going to help us to learn more that how do I practice and I prescribe in my clinic. So let's begin. So this is a case of 34-year-old female. She is into a software profession and she basically consulted me for secondary infertility. She had one girl child, and after that they have been trying for almost 3 years and she is not able to conceive. So let's discuss a little bit about the case. She said that since past 1 year, and this is a very recent case of 2021, she said that in past 1 year her cycle has become irregular and delayed. So she used to get her periods every 45 to 50 days. So and her cycle was also scanty. Before her period she used to get constipated and there used to be back pain before and during the periods. She also had right heel pain, so mainly because of plantar fasciitis. Getting up early in the morning and when she used to put her feet on the ground, there used to be severe pain, aggravated also at night. Mainly she had all right-sided body pains, so right-sided pains which are more at night. And she had past history, or she is a known case of congenital scoliosis. So since birth she has scoliosis, and because of which she has this back pain and right hip pain which is almost there on and off. Past history, she was hypothyroid and she used to take 25 micrograms of thyroxine, but she has stopped that since some time because she said that her thyroid functions are now normal. She also has migraine. Now, as I mentioned, she had a girl child, which she is 4.5 years old, and she had oligohydramnios during her pregnancy. Mother has history of epilepsy and hypertension. Father also has diabetic. Now, let's talk about little bit about her mental sphere. That she has regular work stress because a project is very stressful, and she said that she doesn't want the work to get delayed. So if it gets delayed, she gets a little bit into anxiety mode. She is basically a team leader. So something, if sometimes the team doesn't work properly or things get delayed, she will take the blame on herself, that there's something she has done wrong or she is not doing properly. That is why the work got delayed, and she doesn't like this. And usually she suppresses her emotions and she doesn't express her emotions so often. She gets irritable and she's short-tempered mainly on her child. And she fears failure. She thinks that she is going to fail in her work, and then she weeps, and then there is irritability. Doesn't share her emotion. Now, father expired 2 years after the marriage, and the grandchild was born afterwards. So she has this basic guilt, that the father could not see the grandchild and he wanted the grandchild since a long period of time. So she has this guilt within herself. And she said that she had a lot of early responsibility in the family. Brother is not earning well and she had to support her family, her mother and brother and everyone. And she said no one has said her to take the responsibility, but she herself takes responsibility, and because of it she has been matured early. And if she's not able to fulfill the responsibility, she feels guilty and she feels bad. And her relationship with husband is okay, and she has struggled a lot and she couldn't enjoy her life much. She's a very independent female. She used to have a fear of dark initially, but not now. Usually she weeps whenever there is a lot of suppressed emotions. She generates her thirst was for sips of water. She has allergy to peanuts. Tea causes acidity. Her sleep is disturbed. She gets up on slightest noise, and she has this dream of specifically God, Hanuman. And she also has a dream of someone is chasing her and she's running and hiding, and someone is trying to chase her and running behind her. Perspiration is scanty and she usually has dry skin. So this was the diagnosis: secondary infertility, congenital scoliosis, plantar fasciitis. She also has lumbarization of her S1, S2 spine, and USG, which was done in 2020, showed bulky uterus and left ovarian simple cyst. Now, because she was not ovulating, okay, she had this ovulation strip at home which she used to check for ovulation, which shows alleged ovulation in the strip. But she said since past 1 year she's been checking for her ovulation status and she's not been ovulating. So that could be the main reason for her infertility, and she's not been investigated. So because of anovulation, she had developed a simple left ovarian cyst. So this was the case. Now do write in the comment section what do you think about what could be the remedy which is more suitable for her. Now I have given a remedy. Now if you see in her characteristically, if you see her pathophysiology, she has congenital scoliosis, which is something goes towards a syphilitic trend because it is since birth. She had mainly right-sided complaints. Ovulation is the main problem in her case, which is causing infertility. She is a very conscious person. Okay, she wants her duty to be done properly, and if not, she feels guilty. Okay, she feels guilty. She has fear of failure, and then she blames herself for all the mistakes or anything goes wrong. She is very attached to her father, and she still grieves about, whenever she talks about him. Emotions are usually suppressed. She sleeps on sides and wakes up on slightest noise, constipated before menses, and there is a dream that someone is following her, or and where she is hiding. So this were the main characteristic in this case, and depending on this, obviously we all think about natural mure as the remedy, right? So she was somewhere very close to natural mure, but not exactly natural mure as a personality. So I chose a remedy, okay, which is aurum mure natronatum. Now if you read this remedy, okay, I will discuss this remedy some other time. So aurum mure natronatum was a suitable fit in this case, okay, and you will not believe I had just given her 2 doses of aurum mure natronatum, and in the next cycle, okay, she started in the ovulation strip, okay, she started getting signs that she's been ovulating, which she was not getting earlier, and in that cycle only, okay, and that cycle only she conceived. So within a month of starting the medicine, she conceived. So this was because the medicine which was selected, the homeopathic medicine, which was exact similar to this case, and that is why the result was so quick. So this is the beauty of homeopathy, that whenever we get the exact medicines, the results are very fast. And so I hope you enjoyed this short case discussion, and do write in the comment section what do you think about the case and any other remedies which came to your mind, and I'll share the next case soon. Thank you.